Dr. Mian, I was with relatives up in northern Minnesota. We were moving very big pieces of furniture, and these are very big, strong men who were fine lifting the furniture. But one of them said something that was interesting. He said, "It doesn't bother me to lift things and do things. Sometimes I get excruciating pain. I throw my back out for no reason. I'll get shoulder pain. I'll throw my back out. Don't know what I did. It could be I'm leaning on the counter the wrong way." Can you explain what that is and the best way to avoid that or care for it and what's going on?
I see this very often, even then it's happened to me. And I'll tell you a little bit later about what I did to help with that ultimately at the end of the day to help fix that problem. I analogize this to the game Jenga. That's a game where you have all these blocks that are put together. The game basically is taking each piece out without making things fall. Ultimately, it gets down to the point you just take one block out at the end and everything collapses, and that's the person that loses. If you think about this with the body, things will break down, things will degenerate. The disc will start herniating because there are ligament changes that allow the material to come through. Ligaments also hold the spine together, in this case, like with the back specifically for this. So what happens is that it's quite possible when somebody's lifting heavy things or using back braces to do the work, they're not really having too much because they're using their accessory muscles to help stabilize their core. But as soon as they take that back brace off and then they just go in to bend over to tie their shoelace, they throw their back out and they're on the floor basically at that point. That's that Jenga analogy where you pulled out that last block. And that's because that's that instability between the ligaments, tendons, and joints within the spine. And so when things move, the nerves can also get very irritated as well. So common things to do that are non-invasive, obviously, is you definitely want to work on your metabolic health. For some people, it's going to be big changes in their diet. It's not just a matter of just eating vegetables or whatnot, but it's also a matter of the exercise that they get. So it's not just heavy lifting, but it may be they're on the treadmill moving very fast for 20 seconds and then they're stopping. So they're doing interval training or they're doing other exercises to try to help reduce belly fat. In terms of what I did to help me overcome this, and this is one of the things that I do in my office, I actually ended up having PRP in my back. Probably still need to go for one other. And actually, interesting enough, there's an individual in Minnesota who I go to who's very good at this. I trust for myself that I go to. But just having done 2 treatments for that helped me from throwing my back out constantly because I was doing the same thing where I just slightly hunched over. I'm not like a huge person by any stretch of the imagination, but I used to do something like that. And that was causing problems. And maybe the injuries may have occurred during weightlifting or doing other things. And so the PRP was actually able to help stabilize my spine because it's addressing ligaments, joints, tendons, things that hold your pelvis and your spine together. So we found that to be very beneficial, very helpful. Outside of PRP, as I mentioned before, definitely reducing the circumference of your waist and putting less of a load on your core is helpful. But then, as I mentioned in the beginning, it's also strengthening the accessory muscles. So your hips, your glutes, your thighs, all that, because it acts as a girdle for your spine. So when all of that's firing, so to speak, or activated, there's less load on your spine. But one of those things are working synergistically very well. Where is all the tension going? It's all going back into your spine. And it doesn't take much to set that off then at that point. So definitely the dietary changes, the exercise, very generically for sure. There are different ways of trying to help that, even if things like intermittent fasting or cutting out things like sugar, gluten, bread, pasta, rice. All those things can certainly help and help people drop weight a little bit quicker along with some exercise. For those people that are still struggling, then perhaps the PRP route might be the best option. Steroids are a very common treatment for people with spine pain or back pain, but it doesn't address any of the instability. It just maybe helps the nerve temporarily at best. A lot of people get epidurals and they're very hit and miss. And then if that doesn't work, what happens is that the surgeon ends up trying to remove bone or tries to stabilize things actually by using, for lack of a better word, metals, rods, and things like that to stabilize your spine, which in and of itself causes other issues. Or key, obviously, with anybody is just preventing things and preventing yourself from getting to that point where you are throwing your back out constantly. But if you do have that, then we do know that there are other options, at least that can help and get you out of that pain.
What's your opinion about addressing that particular type of condition with a chiropractor?
I think with the chiropractor, it's something where I try to carefully say is that you can get some temporary relief with a chiropractor, maybe potentially. One of the things that I do find a bit problematic is that when folks are going to chiropractors, they're told they have to come every week or every other week, and they lifelong have to do this constantly. And so they're constantly trying to put things back into place. It keeps popping out. And it goes back to the original point that I had, is that there's instability in those joints and ligaments to begin with. So to address those things, when things are really starting to smolder, that's the time to do it. But the chiropractor obviously is the non-invasive way of doing it. And as long as you're getting relief from that, or you're willing to go frequently all the time and do that investment in time, then that certainly is a simple way of trying to address this, at least for the time being.
All right, Dr. Mian, it was great seeing you. Thanks so
Yeah.
much.
Yeah, I appreciate it. Thanks so much.
Take care. Bye.
All right. Bye-bye.